In this video, we are going to look at a few more projections of the knees. First, let's start off with AP bilateral knees. These are done standing. Prior to having the patient up against the upright bucky, please ensure the patient has removed both their shoes and their socks. Once they've done so, place the patient up against the upright bucky. Ensure that their legs are close to the upright bucky, but more importantly, we want the patient to be standing there stable, as well as having their feet placed forward, placing the knees in a true AP position. Center the central ray approximately 1/2 inch distal to the apex of the patellas. Also, ensure that you have both right and left markers. When performing AP bilateral knees upright, you may collimate from side to side, open from top to bottom. Next, let's look at the bilateral notch views. These also will be done standing today. The one thing to note about notch or intercondylar fossa views is these can be done many ways. Today, we are going to look at the PA upright version. It is important to understand the concept of the notch view. The most important process is to ensure that the central ray is perpendicular to the tib fibs. Here, in this particular notch view, the patient is standing upright. They're resting their thighs up against the upright bucky and holding on to the support bar. The feet have been placed several inches away from the upright bucky. This can be a semi-comfortable position for the patient, and we want to have the knees kind of flexed approximately 45 degrees. However, some patients will only be able to handle 20 to 30 degree flexion. The key element here is to make sure the central ray remains perpendicular to the tib fibs. The central ray should exit approximately 1/2 inch distal to the apices of the patellas. Once again, you will want to ensure you have proper marker placement, both right and left. Now let's compare the bilateral standing to the bilateral notch views. Notice the difference. In the notch views, the intercondylar fossa has been opened up, as seen here. Now, let's move into the sunrise. Here, we won't have the patient laying supine on the radiographic table. When having the patient lay supine on the table, ensure that the patient is rather comfortable. This may require additional pillows or supports behind the patient's head and back. Next, have the patient gradually flex their knees, similarly to as what is seen here. Although the knee joint flexion may vary from patient to patient, ensure that both knees are at the same height or level. Direct the central ray through the patellofemoral joint space. You will want to have the patient also hold on to the cassette for you. Sometimes you may choose to also use a radiolucent sponge to hold the image receptor in place. Remember, once again, use both right and left markers and collimate tightly as seen here. The following image should be produced. Now you have completed additional views, both AP standing, bilateral notch, and sunrise as well.